Okay, hello everyone. This is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. And welcome to our weekly Wednesday live event. Hope everyone's doing well. Before we get started, first and foremost, I want to kind of send my best wishes to everyone that I hope everyone is healthy and doing well. I have a tremendous amount of gratitude that you all are here with me to listen and as I kind of discuss topics of the day, and really appreciate your time and interest. I'd love to get feedback as well as questions. I think it's always helpful to hear from you all in terms of what your thoughts are and how you guys are dealing with everything that's going on in the world right now. I think it's a really interesting point in life right now in that we're all kind of readjusting our sense of where we are in this new normal kind of COVID world. We're still finding our way. And I think a lot of us are trying to get back into some semblance of a normal life. As an example, we all know that life continues on. For the example I have is my daughter has kind of formally learned how to bicycle, and she was cycling this weekend, and that was pretty exciting on a holiday weekend for her to learn how to do that. That sort of means I need to get a new bike, and now we can go cycling together. And obviously in a COVID world, you have to think about different things. You have to think about not only how does she cycle, but you have to think about, do you keep masks in her bicycle little cart as well? Because in case you stop by somewhere or you run into someone, how do you handle those kind of things? And so that's our new normal. And I know there are people who have concerns. And when I talk to patients, the feedback I get is there's some people who are just kind of rolling along, not thinking too much about anything, just kind of going with the flow. And there's other people that are really kind of nervous about things and really having to think through things a lot more. And they need a little bit more guidance and reassurance. And I think regardless of how you're approaching things, I think as long as you're being thoughtful and considerate to your own sort of risk tolerance and the concerns that you may have medically, and you have people, whether it's physicians or other people, family members, other experts that can help guide you, I think it's important to kind of lean on them during this time. Okay, so there were two kind of articles that I read this week that I think are interesting because they kind of connect with the whole idea of risk and how we should be thinking about information. They're both related to your musculoskeletal system. The first article that was interesting was an article that came from a large Israeli health database that found that for people that are using metformin, a diabetes drug, they had an association with a reduced chance of actually developing rheumatoid arthritis in women. It's interesting because there's the headline to the whole thing, which is, hey, take this medication and it reduces your risk of rheumatoid arthritis. But that's not really accurate. The first thing to understand is that there's a difference between association and causation. What that means is, while taking that medication, metformin, might mean that you have a lower, that there may be an association with lower chance of developing rheumatoid arthritis, but it doesn't mean that just taking that medication is what's doing that. There's more to the story than that, and that study doesn't fully explain that. But what I think is more interesting is that for people that have autoimmune conditions, rheumatoid arthritis, inflammatory conditions, that it's good for them to think about their metabolic health. Because the reality is, long-term, if you are prone to inflammation, you're then also prone to higher rates for cardiovascular disease. Metabolic syndrome is basically a collection of risk factors for cardiovascular disease. Things like diabetes, high cholesterol, being overweight, a number of different things that make you more prone to heart disease and cardiovascular disease long term. So rheumatoid arthritis, because there's chronic inflammation in arteries and veins, puts people at higher risk for those kinds of cardiovascular issues as well. So I think it's an interesting article because it gives us a chance to think about what are the longer term issues that people with autoimmune issues have that they should be thinking about. And the takeaway to me is, are we doing enough on the medical and physician side, but certainly on the individual side as well, that when it comes to your long-term metabolic health, are you thinking about the right kind of things to make sure that you're taking care of yourself and your autoimmune risk long-term? So, the really simple answer is yes, you should be thinking about things like your diet, your exercise, the supplements that you're taking, all those kind of basic things so that you're healthy long-term. But I think we on the medical side can be doing a lot more when it comes to helping to guide people in terms of their metabolic health, and functional medicine is really the approach to that. So something I've been thinking a lot about the last couple of weeks is how do we present a plan and properly help our autoimmune patients, our inflammatory patients, so that we can help treat some of those longer term issues. And I think functional medicine and our approach to that is the way to go. And so over the next couple months, even several weeks, you'll start to hear me talk more and more about that, about a possible plan and approach that we're going to offer to our autoimmune patients on the functional medicine side to help people out with some of those issues. Because I think that is really a key but lacking aspect of the care that most of our autoimmune patients get. And so again, to me, the takeaway from that study that I mentioned is not, hey, everyone should be taking metformin. It's, hey, this is an opportunity to think about metabolic health and ways that we can maybe take care of our autoimmune patients that maybe is being neglected right now. So something to look forward to that I'm pretty excited about that as we kind of figure out that kind of thing. The second kind of interesting study that came out was something that came out from the Osteoarthritis Initiative. The Osteoarthritis Initiative is essentially a large cohort of patients that are followed at multiple different sites throughout the United States. And it's funded by the NIH, a large government funding group, where they kind of track issues that are related to arthritis patients. And they reported something recently that's very interesting, which is that there's an association with steroid injections into the knee and the risk of knee replacement down the line. And that risk seems to be about a 9% risk with each steroid injection, up to roughly 36% or so, higher risk of knee replacement down the line. Again, important to understand association and causation are separate things. There's an association of a risk here. Hard to say whether or not that's directly a causative risk, meaning someone that has progressive and bad knee arthritis is likely also going to be getting more knee injections anyway. And so hard to say if that steroid injection is directly leading to more risks for knee replacement, but this is something that from a risk standpoint, you should be thinking about if you have knee arthritis. Namely, we know that there's issues with steroid injections. There's probably a role for steroid injections on a very intermittent and rare basis in patients that have like really severe inflammation, where it may be beneficial on a short-term basis as you try to figure out the long-term solution for someone like that. But for just regular knee osteoarthritis, there's too many side effects to steroids that you should be thinking about these risks in a different way. Whether that risk is due to breaking down cartilage and tendon cells that high-dose steroids can do, or whether high-dose steroids increasing the risk of avascular necrosis, meaning really kind of destroying the blood vessels in the bone, leading to damage and necrosis in the bone. There's too many risks at the local level in that joint where you shouldn't be getting repetitive steroid injections. Number two is there's a lot of systemic effects, meaning this can affect your metabolic health. This can affect your risk for diabetes, high blood pressure, heart disease. So you should be thinking about the risk associated with this. And when you think about the risk, you then have to think, what are your other treatment options? And I'll mention that in a second. But an example of this is actually my own mother-in-law, who over years, her physicians were giving her multiple injections, steroid injections into her knees for knee arthritis. So as you can imagine, when I realized this, and not to mention her daughters, including my wife, who's a cardiologist, we kind of said, this is really not good for her. And when you look at her imaging for her knees are pretty beat up. And part of that is just because of her active lifestyle. But I can't help but wonder, is some of the bone breakdown due to getting a steroid injection every 3 months for years? And are her risks for metabolic syndrome significantly worsened because of those excessive steroid injections that she's gotten over years as well? And when I think about that, and we think about what our solution was for her after that, I can't help but think that the excessive steroid injections were not a good thing for her. So what her solution has been for the last couple of years is we ended up going over to more of a regenerative medicine treatment approach. And in her case, that's been a combination of utilizing platelet-rich plasma, her own platelets, and bone marrow-derived stem cells to treat her knee osteoarthritis. And despite the fact that she's had some very beat-up knees over the years and a lot of damage, she's done quite well in terms of pain, in terms of improvement in pain, in terms of improvement in function, and even in terms of stability. And so she's done well because we've taken that alternative approach. And part of that comes from because we've looked at the risk associated with the steroid injections that she's taken and said, this is not really what's right for you, and let's try a different approach. And those approaches can include not only your own platelets or bone marrow, but they can also include just using regular old prolotherapy that can help. But I think it's important at this time that we should be thinking about risk more and more and not over accentuating the risk of certain things, but definitely being honest about what are the risks for a lot of the mundane, everyday things that we're doing that we can be doing a better job with. Whether that's thinking about your metabolic health, if you're someone who's prone to inflammation, or whether that's someone who's got relatively routine wear and tear arthritis in the knees, or lower back issues, or tendonitis in the shoulders. What are the healthy ways that you can treat this without causing more risk and damage? Because while we think about risk right now because of COVID-19, the risk of steroids is not only the risk of infections in the setting of COVID-19, it's the risk of diabetes. It's the risk of damaging your knees more. It's the risk of progressing things. And maybe that increases the risk of needing a knee replacement down the line, but we know that we can do a lot better for patients by offering other treatment options that have traditionally not been utilized because the easy, convenient option has been steroid injections. And I'm glad to see articles like this coming out saying that there may be an association for worse outcomes because that's real and we can do better than that. And so at this moment, as we're trying to think about how we get back to a new normal during COVID, post-COVID, the rest of our life, let's think about how we can do better with the routine things that we're doing. Because I think we can do better for not only patient care, but we can do better individually when it comes to taking care of our health. And this is a moment where we can do that. I had an interesting conversation with a patient today where he said that he's been exercising dramatically more during COVID. He bought a Peloton, and instead of using it once or twice per week, he and his wife are using it every single day. So he's dramatically healthier than he's been. He's losing weight, his knees are feeling better, and even his RA is feeling better. He's doing so many right things. He's taking something that's challenging, and he's now finding a way to actually do better. And I think that's very encouraging as we all kind of move into this world where we're trying to deal with a new normal. Okay, great. Well, I appreciate your time and questions, thoughts, send me them. If you'd like to hear about other things, send me your thoughts on what you'd like to hear about. But until next week, have a good day, live well, and thank you for your time. Bye-bye.